Hello viewers, welcome. This is your host Nurse Roslyn Bodiambo on Skills versus the Midwife. Today's video we are going to learn about abdominal palpation for a pregnant woman, and therefore we are going to look at the various reasons and understand why it is important to perform an abdominal examination so that we can be able to elicit the fetal position, fetal presentation, the lie, the engagement, and also we are going to determine the fetal heart rate. Besides that, we are also going to do the abdominal examination so that we can be able to assess the size and also the shape of the abdomen through inspection. And finally, we will do this exam so that we can be able to know whether or not we have multiple gestation. And in our assessment, of course, we will include assessment of the bladder and even the environment and also the equipment. And when we come down to planning now, this is where we have to prepare ourselves, and part of preparation for ourselves will include being able to get ready with the equipment needed, and also making sure that we rapport the client and seek consent. Aside from that, we are going to ensure that we have the requirements to perform the procedure, and we are going to look at them in a few. Then also we are going to prepare the environment. Remember, privacy is very important. And then after the client has been talked to and advised about the procedure, then we will make sure that we ask the client to go and void. It's important because if the procedure is performed on a full bladder, it will be very uncomfortable for the client. What do we need for this procedure? Therefore, with me here we have a fetoscope. So we'll need a fetoscope so that we can get the fetal heart rate. We will also need a tape measure that will help us to get the fundal height. Okay. We'll also need sanitizer and aqueous gel in case we are going to use a Doppler ultrasound. We may need some aqueous gel to use. Then you also need linen, all right? So as you're preparing your environment, make sure you have linen so that you can use to cover the client. Remember, we need to maintain privacy and to make sure the client is very comfortable, so that any part of the abdomen that is not being assessed, therefore will not be exposed. We will move on straight to the assessment. We are going to start with inspection. We are going to start with inspection. So allow me to drape my client. So any part that I'm not assessing, I will make sure that I cover. So let me drape my client from below and also from above. Okay, let's follow closely. Part of the abdominal examination involves the Leopold's maneuver, and this one entails 4 major maneuvers that we do. We have the frontal palpation, we also have the lateral palpation, then we also have the colic grip, and finally the pelvic palpation. Behind me is a chart that indicates the different kinds of palpations that we're going to do that involves the Leopold's maneuver. So let's inspect the abdomen. That is where we start from. So make sure that the client is comfortable on a flat bed or on a flat surface. So part of the inspection, this is our abdomen, okay? This is the mother's abdomen. And part of the inspection, what to inspect on the abdomen will include the size, all right, and also the shape. So sometimes you realize that the abdomen is globular or is very large in size, and that can also help us to understand that maybe we are having a multiple gestation or a big baby, to that matter. And also the contour. Then also you're going to inspect for any fetal movements, and also look at the surface of the abdomen if there are any marks, all right, or if there are any scars. And scars can be due to previous operative procedures that have been done on this woman, including the cesarean section. There's a very distinct line that is called the linea nigra, and then also the stria gravidarum that are similar to stretch marks. So normally when the uterus is enlarging due to the growth of the fetus, you realize that we have stria gravidarum that are visible on the surface of the abdomen. So let's move on and perform. And remember, before you can touch the abdomen of the mother, you can try to warm. We have already cleaned our hands and dried them up. So just to maintain the temperatures a little bit, we are going to warm our hands. So So we are going to start with the fundal palpation. And the fundal palpation is what will help us to elicit the fundal height. That is the age of the pregnancy up to date. So with firm, continuous movements, try to locate where the mass of the fetus is reaching. Okay. Once you elicit that, okay, so let's say for example that is where the mass is reaching, then get your tape measure. Get your tape measure, and remember you're doing this when you're facing the head towards the head of the mother. So get your tape measure and look at we have both sides. We have the inches side and we have the centimeter side. So place your tape measure from the level of the symphysis pubis, and the centimeter side should be facing down. So once you place it like that, then you're able to locate up to which point the fundus is reaching, and then you can read. Okay. Turn your tape measure and read what the finding is. So for example, my finding is 28. So 28 centimeters is directly translated to be 28 weeks. Is directly translated to be 28 weeks. So that is our fundal height. Then after that, then just continue on with firm, continuous movements, and move the hands, slide them to locate the fetal back on the lateral. Remember, this is lateral palpation. So slide your fingers, all right, on both sides with firm pressure on one side like that. Then you can palpate to feel for a continuous, firm but continuous mass, and do the same for the other side. So firm grip on one side, slight pressure, so that you can palpate the opposite direction as well. So the place where you locate a smooth continuous mass, that is where the back is likely to be. Then pick your fetoscope, place it where you have actually located the continuous mass, and count the fetal heart rate for 1 minute. Let's move on to the next palpation, and it's normally called the Pelvic grip. So when you're done with the lateral palpation, then you move to do the Pelvic grip. So in this case, you will place using your thumb and the rest of the fingers, you're going to place one hand gently to grasp the upper portion of the abdomen, okay? The upper portion of the abdomen, and then the other one will be holding the lower portion towards the symphysis pubis, so that you can be able to feel which is the presenting part and whether or not the presenting part is moving. Okay, is it ballotable or not? So what is the presenting part? Is it a hard mass? Is it a smooth mass? And using your thumb and your finger, you're able to feel that, and then you're able to elicit whether or not it is moving. So that we are assessing for engagement. Then the last maneuver, or the last kind of palpation in this case during our abdominal examination, is what we call the pelvic palpation. Now there's a reason why I've turned on this side, because for the pelvic palpation you need to turn and face towards the feet of the mother. So how do we go about this? All right, so for the fourth maneuver, which is the pelvic palpation, you will face towards the woman's feet. Then using your palmar surface of your hands, place them on each side of the abdomen. Then try to move the hands on each side of the abdomen towards the symphysis pubis. Okay, palpating with the fingertips. So you're using your fingertips to grasp and have a feel of what is actually down at the pelvic region. Now, the reason why we are having the movement, all right, so that we can assess if there is any resistance on either side. Now that will help us to elicit few findings, to include attitude. So we are trying to look at whether there is flexion, all right, of the fetal presenting part, or extension. This can also help us to confirm the engagement. When we look at the chart that I have here, it summarizes what we have done and the different findings. For example, when we talk about the fundal palpation, which is the very initial palpation that we do or maneuver, then we have the finding here is the fundal height. Then the lateral palpation, this is the finding that will give us the fetal lie. Remember, we have three types of fetal lies. We have the longitudinal lie, we have transverse lie, and we have the oblique lie. So depending on how the fetus is lying, then it can either be longitudinal, transverse, or oblique. Oblique is almost like diagonal. Then through the lateral palpation, and after we locate the fetal back, then we can elicit findings like fetal heart rate. And that is why we were using our fetoscope to place to place it on the mother's abdomen and actually listen to the fetal heart sound for a period of 1 minute. Then also, finally, we can find one other finding would be position. And for the position, if for example I was able to listen to the fetal heart rate on the right side, then automatically that becomes right. Okay, right. And if the fetal head is on the is the one presenting, that should be right occipital anterior. The reason why it's anterior is because I'm able to feel for the fetal heart rate easily. If I would have difficulties locating the fetal heart rate, probably the fetus is lying towards the posterior side, then that, of course, that would need to be confirmed through an ultrasound. But again, that would not be an anterior position, it will be a posterior position. So if I'm able to locate it here, then that is anterior. For example, this would be now right occipital anterior. And we have various other positions that we can get as findings in this case. Then for the third grip, palpation or maneuver, we have the polyp grip, where we can be able to elicit the fetal presentation and also the presenting part. So there are different types of presentations. We have cephalic presentation, we also have breech presentation, and various others that could not be classified as normal. We could be having shoulder presentation, face presentation, brow presentation. So there are various of them. The most common one being cephalic presentation, when we have the head being the presenting part. Okay, then also we can find out engagement through the polyp grip. So if the presenting part has descended down the pelvic brim, then there is engagement. If there is no engagement, then the fetal presenting part will be balloting. Then we have the final one called the pelvic palpation from this chart, as you can see. So for pelvic palpation, some of the findings that we get is attitude, and we said attitude is a way of is a finding that determines whether or not the fetal presenting part is completely flexed or extended. And then we also have we can confirm engagement through the pelvic palpation. Feel free to put in your comments, feel free to put in your questions. They will be addressed, they will be answered. Thank you.